Hello, my name is Noah Lukart, and this is my personal learning network. So, as I prepare to transition into my role as an APRN and a future nurse practitioner family, I recognize the importance of building a strong personal learning network. This network serves as both a foundation for lifelong learning and a bridge to a bigger community of advanced practice providers. I selected three of these platforms that reflect my personal interests and can support my growth across domains through our course outcomes, including informatics, ethics, and technology and practice. All of these domains and platforms, they include the American Association of Nurse Practitioners, a LinkedIn neurosurgery discussion group, and then lastly is an Instagram page known as Real World NP on Instagram. So for the first one is the American Association of Nurse Practitioners, and this is their newsfeed page. It has all up-to-date articles, and they even have sections here that you can do education, practice, advocacy, and year-to-date things for the latest. Um, But I subscribe to their newsletters, email updates, and plan to use this news feed section on their page. It serves as a place for just evidence-based practices that are up to date, new policies that are developing, continuing education opportunities. And this aligns with course outcome number two, which focuses on informatics, improving advanced practice nursing and outcomes. It's delivered through a platform. It's very easy to use and easy to navigate. It's easy to stay informed on topics ranging from scope of practices to clinical protocols, things like that. And then course outcome number three, they regularly publish these content about legal implications of prescribing, ethical dilemmas, healthcare finances. Um, and then the fourth outcome, it offers things like webinars and technologies like telehealth, electronic health record integration, things that, and they're easy to sign up for too. And this is all impacting of the technology of nursing um, as a whole. So my second platform is a neurosurgery LinkedIn account. Um, so this one I'm actually still had to request to join. I have it on my personal email, but I'm actually locked out of LinkedIn right now. I guess I had my password wrong too many times, but I've been in this group now. Let me get back to that. Um, I've been in this group. The people are all super nice and super helpful. It's just kind of a place to discuss complex cases, surgical techniques, kind of new approaches to surgeries, and just difficult patients. Um, I work in a neuro unit, and I kind of use this more often than most. But this course outcome number two, it demonstrates informatics and digital communities based off this platform, and then also course outcome number three, members they like I said they exchange ideas on scope of practice, clinical and ethical considerations, all for neurosurgery patients. And then course outcome number four, it shows neurosurgery care and involving these using different types of imaging during surgery, advanced documentation, tools, and overall just plan of care. Um, and this can kind of just help me as I uh, go about my nurse, becoming a nurse practitioner, just kind of put myself in that role and having people to bounce ideas off of and really, collaborate. And then lastly, the Instagram, the Real World NP. Um, this is an account that it's a highly relatable nurse practitioner. She offers daily insights, tips, refreshers on clinical topics. Her platform is focused on real life patient scenarios and includes accessible breakdowns and diagnosis and management. Especially, it's useful for new and inspiring nurse practitioners. Sometimes I feel like social media doesn't really feel like work, so more can be learned, or so what kind of can be called having fun. Uh, Ideas, they may stick better that way. This page meets course outcome number two, as it offers a way to absorb evidence through a digital platform that enhances learning. It also aligns with course outcome number three. This page often covers the ethical and practical aspects of prescribing and managing treatment plans, including how to communicate with patients as well as other healthcare members. And as far as outcome number four, this platform, it showcases the integration of mobile apps, like I said, electronic health records, other technologies that really support the efficiency of safe practice overall. And here are my references. But together, all three of these components of my learning network, they offer a foundation of professional growth. Through this graduate program, I'll continue to use these tools to access updated content, interact with experts that are already in the field of my interest, stay informed with current best practices. Even after graduation, I can plan to use this learning network to engage in continuous learning. I can do continuing education hours, network with professionals in both primary care setting as well as specialized field like neurosurgery. And this is just a valuable resource to turn in. And when I face clinical questions in practice and dilemmas and need guidance, this is a good place I can turn to. As far as explaining this to a work colleague, I would describe it as a personalized support system. Honestly, this network can connect you with many resources that not only keep you on the best practices, but they give you a place to ask questions, reflect on the challenges that you've had with others, and as well as celebrate your successes. Sometimes you put in a lot of hard work and don't get a kind of brag on yourself, so to say. But whether these get updates from national organizations or learning just from fellow NPs on social media, um, this helps you stay in grounded evidence-based practice and connects you with a wider professional community, all to better yourself and better yourself for patients. This is my learning network. I've personally liked researching on these topics, and I plan to look forward to continuously learning from them too.